Hi, my name is Christina, and in this presentation, I will walk you through the Affordable Care Act and public health. I will first provide an overview of our current U.S. healthcare system, in which I will discuss the Affordable Care Act, Canada's healthcare system, and public health in the Affordable Care Act. To begin, I will give an overview of the current healthcare system in the United States. In the United States, we have a dispersed healthcare system, which is a healthcare system with an independent organization. This is compatible with values and expectations in the United States by placing a high premium on direct access to specialists and tertiary care services and autonomy. This allows the patient to enter the healthcare system at any level and allows patients to select healthcare providers for their particular healthcare needs. It promotes flexibility and convenience in the availability of facilities and personnel. U.S. hospitals are able to offer the latest in specialized and technologically advanced care in many hospitals. The United States healthcare system is financed through multiple payers and the government to comprise a hybrid finance system. The employers and employees pay for health insurance. Insurance may be purchased independently by individuals through healthcare companies or through healthcare marketplaces, which may be subsidized by the government if qualified based on income. The government pays for health insurance for the poor, elderly, and disabled, and others pay out of pocket for healthcare services. Public health insurance programs are funded and run by the government and are based on income. Medicare is a federal health insurance program for people over age 65. Medicaid is a federal health insurance program for low-income and vulnerable Americans. It provides health care at a very low cost for those who cannot afford it. It can also pay for long-term care like nursing homes. CHIP, or the Children's Health Insurance Program, is similar to Medicaid and is designed to provide health coverage for people under age 18. Medicaid and CHIP are run by each state and there are financial requirements to qualify. Privately financed health insurance may be purchased independently or through the marketplace through health insurance companies such as Blue Cross, Blue Shield, Aetna, Kaiser, Humana, HealthNet, Western Health Advantage, and Molina Healthcare. The U.S. healthcare system has considerable strengths. It has a large and well-trained health workforce and a wide range of high-quality medical specialists, as well as secondary and tertiary institutions, a robust health sector research program, and has the best medical outcomes in the world. The advanced state of technology is the greatest strength of the U.S. healthcare system. For example, premature babies face relatively good chances of surviving if they are born in the United States because of the state of technology. A relatively high life expectancy after age 80 is another reflection of the advanced state of healthcare technology in the U.S. People 80 years and older in the U.S. tend to live longer than their counterparts in most other countries because of the abundance of advanced medical technology. Hospitals in the United States aspire to offer the latest in specialized care at a convenient distance from home. In most urban areas, several hospitals compete with each other to perform open heart surgeries, organ transplants, radiation therapy, and high-risk obstetric procedures. Along with quality specialists and facilities, the United States continues to be the world leader in pharmaceutical innovation with products which save, extend, and improve the quality of life. The U.S. healthcare system also has notable weaknesses. The U.S. healthcare system is the most expensive in the world, comprising 17.7% of the gross domestic product of the nation, which equates to $3.6 trillion and a per capita national health expenditure of $11,172. Although the U.S. has high healthcare expenditures, U.S. has lower life expectancy, higher infant mortality, problems with access, lower quality and efficiency, and is ranked last in overall health system performance when compared to 11 developed nations. The United Kingdom ranked first, Germany 8th, and Canada 9th. In the United States, more than half of physicians are specialists, inducing a top-heavy healthcare system, which results in a shortage of primary care providers and reduced access to primary care. Primary care is essential to provide preventative care, teach healthy lifestyle choices, identify and treat common medical conditions, and make referrals to medical specialists. Primary care allows for an optimal patient-physician relationship develop as well as serve the health needs of a community. Now I will discuss the Canadian healthcare system, which ranks better than the US despite shared technological information and proximity. The Canadian healthcare system expresses the fundamental equality of Canadian citizens with a single-payer universal healthcare system, which is comprehensive, universal, and accessible. Every Canadian receives the same health insurance regardless of wealth, employment, or age. Funding is provided by the federal government and provincial governments from income, payroll, and sales taxes. There are no deductibles or copays, and hospital, physician, and ancillary care is provided. Private health insurance may be purchased for gaps in coverage in the provincial health plan, but not for coverage of services included in the provincial health plan. Private health insurance covers pharmaceutical benefits, home care, vision, dental care, and private hospital rooms. This figure depicts the structure of payment for the Canadian healthcare system. Taxes from the federal and provincial governments fund provincial health plans, which then provide funding to hospitals through the global budget and to primary care physicians and specialists through fee-for-service, capitation, or salary methods. In 2015, half of Canadian physicians were family physicians, which enhances primary care delivery systems. Family physicians care for routine medical problems and refer Canadians to specialists. Specialists are allowed to see patients without referrals, but only receive the higher specialist fee if there was a referring primary care physician, prompting most specialists to not see patients without a referral. Canadians have free choice of physicians and are allowed to care for their patients in hospitals. Canadian medicine is similar to the United States because of the close scientific interchange. The differences lie in the financing system and the greater use of primary care physicians. The Canadian healthcare system is one of the better healthcare systems in the world, providing universal, comprehensive, and accessible coverage to Canadians whom, in large part, are satisfied with the Canadian healthcare system. The Canadian healthcare system is more affordable, with total health expenditures at 10.4% of gross domestic productivity and per capita health expenditures at $4,826. Canada's universal insurance system has created a fairer system for distributing health services, which includes less financial barriers to medical care and greater access to primary care physicians. Canadians also benefit from a robust financial safety network, which assures citizens do not experience financial difficulties for health care. With a robust primary care delivery system, Canada benefits from multiple models of primary care, which allows Canadians to choose from a family physician, a nurse practitioner, a group practice, or team-based care. A robust primary care system reinforces the Canadian value of community by assuring the health and well-being of more Canadians. The Canadian healthcare system also has significant weaknesses. Canadians pay higher taxes to support the healthcare system. The average household pays $11,000 per year on healthcare services through income taxes, payroll taxes, and sales taxes, or about 10% more than American households. For Canadians, prompt access to healthcare services is more difficult. Canadians experience longer wait times for specialists, specialty services, and treatments. For example, the median waiting time to see a specialist physician was 21.2 weeks between referral and treatment. Canadians also suffer from an uneven distribution of health services, with urban healthcare centers providing better coverage than rural facilities due to funding and services offered. While being financially affordable and in large part free of charge, Canadian public hospitals provide less patient-centered care, performing much like a public sector organization like the Postal Service or tax collector. The Patient Protection and Affordable Care Act, also known as the Affordable Care Act or Obamacare, is a comprehensive healthcare reform law addressing health insurance coverage, costs, and preventative care signed into law by President Barack Obama in March of 2010. The enactment of the Affordable Care Act mandated the expansion of insurance coverage. The healthcare marketplace was created, which provided a platform where the public can compare and enroll in health insurance plans found online at healthcare.gov or a state-specific marketplace. An individual can determine eligibility for Medicaid, a federally subsidized health insurance plan, and purchase an adequate health insurance plan. Medicaid was expanded to include individuals with incomes at 133% of the federal poverty guidelines. Parental policies were expanded to cover young adult children until the age of 26. Employers were also required to expand coverage to full-time employees, in which small businesses were granted tax credits. The Affordable Care Act also increased consumer insurance protections. Policies such as cost limits on coverage, rate increases, claim denials, and canceling coverage have been halted. Health insurance companies can no longer impose a lifetime limit or a yearly limit which financially caps the plan, requiring the policyholder to pay the additional cost. The ability to raise premiums without an explanation was also reformed, requiring a just public explanation if the rate increase is greater than 10%. Health insurance companies can no longer deny claims without an appeals process or an external review, allowing policyholders to obtain appropriate medical opportunities if necessary. Lastly, coverage cannot be canceled if a mistake has been made or an irrelevant healthcare omission is made. The Affordable Care Act also improved health quality and system performance. The ACA requires healthcare plans to offer essential health benefits, which consist of emergency services, ambulatory patient services, hospitalization, prescription drugs, laboratory services, maternity and newborn care, pediatric services, substance abuse and mental health services, rehabilitative and habilitative services, as well as preventative care and chronic disease management services. The ACA also strives to improve care coordination for Medicare and Medicaid, invest in health information technology, develop payment mechanisms to improve efficiency and results, develop medical malpractice alternatives, and reduce medical errors, and also study the effectiveness of various medical treatments. The ACA also makes provisions to curb rising health costs by providing more oversight of health insurance premiums and practices, emphasizing prevention, primary care, and effective treatments, reducing healthcare fraud and abuse, reducing uncompensated care to prevent a shift into insurance premium costs, fostering comparison shopping and insurance exchanges to increase competition and price transparency, implementing Medicare payment reforms, and testing new delivery and payment system models in Medicaid and Medicare. The Affordable Care Act emphasizes prevention and wellness by establishing a Prevention and Public Health Fund to provide grants to states for prevention activities such as disease screenings and immunizations. It created the National Prevention Health Promotion and Public Health Council to coordinate federal prevention efforts, including those to address tobacco use, physical inactivity, and poor nutrition. The ACA requires insurance plans issued after March 23, 2010 to cover certain preventative care without cost sharing, such as immunizations, preventative care for children, and specified screening for certain adults for conditions such as high blood pressure, high cholesterol, diabetes, and cancer. It also increased Medicare payments for certain preventative services and established a federal home visiting initiative to help states foster health and well-being for children and families who live in at-risk communities. The ACA also requires Medicaid programs to cover tobacco cessation services for pregnant enrollees and federal public education campaigns about oral health. The U.S. health system has considerable strengths and notable weaknesses. The United States now has near universal health coverage, with health insurance covering 9 out of 10 Americans, compared to 1 in 6 Americans before the enactment of the Affordable Care Act. It has improved healthcare equity, quality, and affordability, as well as increased primary care access and increased preventative health care. Public health programs have also been strengthened as well. There has also been weaknesses in the Affordable Care Act. Healthcare plans for 15 million Americans were canceled, requiring those to enroll in an ACA-approved plan. Small businesses were also required to provide health insurance to full-time employees, prompting some employees to lose full-time status. There is also a coverage gap which affects uninsured adults whose income is above the state's Medicaid limit, but less than the 100% threshold for marketplace subsidy eligibility, requiring those to partially pay for health insurance, even though there is financial difficulty. Approximately 9% or 3 million Americans fall into this coverage gap. Another coverage gap exists in states that did not expand their Medicaid program, which left an additional 5.2 million adults without coverage. Despite all of the Affordable Care Act's rules and regulations, limits and protections, healthcare cost is still expensive and expected to keep increasing. There are more individuals paying into the healthcare system, but provisions requiring insurance agencies to cover pre-existing conditions and to not charge for preventative services, as well as technological advances and other services, will undoubtedly cause healthcare expenses to continue to rise. The Affordable Care Act provides direct support to enhance national public health efforts. The ACA and public health have established a relationship to address the prevention of illness and disease in order to complement and improve healthcare delivery. Primary prevention through public health action can be enormously effective in reducing the burden of human suffering and the cost of treating disease. The public health approach seeks to reduce disease in the population as a whole using strategic standards such as mass education campaigns to counter drinking and driving, the taxation of tobacco to drive up its price and encourage cessation, and the labeling of foods to indicate fat and cholesterol content. Armed with this knowledge, the ACA set up the Prevention and Public Health Fund, which contains many new provisions designed to improve public health and wellness and address 4 key prevention areas, which are community prevention, clinical prevention, public health infrastructure and training, and research and surveillance focused on workforce wellness to ensure the well-being of the health of the nation through prevention rather than cure. Thank you.